My name is Alicia Michaelsen. I have been a nurse for close to 15 years, and 12 of that has been working with hematology oncology, so heme malignancies. I think we as nurses are in a very special position because we spend so much time with patients and their caregivers. So we have this, because we're so close and spend so much time one-on-one, we're able to provide more tailored and very specific education to help patients through this cancer journey. First point is where our nurses are involved in so many different points during the cancer journey. First step would likely be to assess where your patient is at whatever, step they're in. So assess and, engage what their knowledge basis is and where those gaps might be. Depending on where you are in that cancer journey for the patient, they have likely been exposed to their oncologists, mid-level providers, different members of the care team. So really trying to meet them where their educational need is. And do you need to do a big picture education, give an overview, or do you need to do something more specific? Can the patient can they just engage in what we're doing in this moment right now? A lot of times patients, they definitely want to feel validated and looking for a sense of control in the cancer journey. So letting them explain, what it is that they, have read or what information they've taken in. So I will ask patients, to explain where, can you explain, what it is that you're talking about, how this, relates to their treatment. Let them explain it to me and then ask the resource, where did you get that information? In that conversation, I think what's really important is the tone and how you're communicating with the patient. So keeping your tone very, keep it very kind, maintain a very open line of communication so they don't feel that they're being attacked or talked down to. And if what they are saying to you does feel incorrect to you and you feel that you can address it, you have that knowledge base, very gently, once they've finished speaking, then speak from your experience and your knowledge, to try to correct that information. If it's a topic that you're not 100% sure of, that's okay. There's no shame because there is absolutely no way for all of us to know everything about every cancer diagnosis or treatment. So it's okay to say, you know what, I'm not completely sure about that answer, but I can find that answer out for you. That is where we're a multidisciplinary team. So going to your other members, like your physician, pharmacist, dietitian, they can help you with that knowledge base to educate that patient. Or you can have those individuals reach out to your patient directly, whatever you feel is most beneficial. If we can think about way back when we were in school, maybe thinking about what resources, how we would, verify and validate resources for our own education, looking at author, what are their credentials, quality, are there references within those publications that you can verify? And then also currency. When was that? When were these, publications put out? Was it 1993 or was it 2023? There's a big difference. In terms of what's early, early on in the journey, where you can always find reputable resources. NCCN, their guidelines are always up to date in terms of, the cancer itself, how to explain what that cancer diagnosis is, what treatment may be, what that, outline may be. ASCO is another publication, another resource that is fantastic. Obviously, there's some that's geared towards healthcare professionals. But there are also publications that are directed, educational materials directed just to patients. So being able to provide those really that you would go to as a nurse that are evidence-based, clearly researched, you can provide that. Another avenue of education would also be if you look to your cancer subspecialty. So for me in heme malignancies, I have references, LLS, MMRF, BMT InfoNet. Um, those those groups or societies have publications that can either be, given to patients. May have access virtually or digitally, or physical copies. You can also get those physical copies for patients that would like that. There's an old saying or an old adage that knowledge is power. I think that applies to our patients during this journey as well. Giving patients the knowledge base and making sure that they feel prepared can help give them a feeling or a sense of control in a situation where really control has been taken away from them. And they're just trying to find anything to grab onto.